welcome everyone to this Friday webinar. We're so glad you were able to make it. I'm sorry that I'm not David Drapkin. Unfortunately, he couldn't make it. So my name is Johanna Hilla, and I'm a colleague of David's, and I'm one of the coordinators of our vital 12-month psychedelic education and training program. So today, I'm so excited to be hosting Mike and hearing more about his work and his ongoing book project, and also share with you all a little bit about our training program and about what we do here at Psychedelics Today and what we believe psychedelic education should look like and how it can help us to pave the way for a future healing and a more compassionate world. So just to kick things off, I'm going to read a very short introduction about you, Mike, and I hope that you can maybe complete this afterwards. So Dr. Michael Sapiro, one of our beloved instructors for Vital, who's been working with us since the very beginning and has been doing excellent job as an instructor, is a clinical psychologist, psychedelic assisted therapist, Dharma teacher, meditation researcher, writer, and workshop and a retreat leader, and a former Buddhist monk. And it is so good to be here with you, Mike. And I hope that we can have a really interesting dialogue back and forth talking about non-duality and truth medicine and about psychedelic education and about your book here. So if you would like to take it from here, maybe add a little bits and bobs about who you are for those of you who don't know you from before. And then, as I understood, you would like to start with the meditation, so we can go from there.
Awesome. Well, hello, everybody. I always wish I could see you so that I could really be here with you in person. So I'm just imagining a row of heads on the top of this thing, and you're all here with each other and with me. There's really a lot of power in a group. And so we even today in the next 50 minutes or an hour can do work on the inside of us that will have an impact on the world around us. So I always like to think of webinars as opportunities for us to do the healing and growth internally, and then that which will impact our external world. And we certainly need that right now. So some other things to know. I work primarily with combat veterans, first responders. So that's police, fire, wildland fire, EMT paramedics. Of course, I have a regular practice for community members too, but a lot of my psychedelic work is focused on that population. I run retreats with combat vets, special operations combat veterans, and then I do psychedelic psychotherapy. So there's a difference between psychedelic therapy, ceremony, and then psychedelic psychotherapy. I actually practice all of those, and we may get into that, but Vital really touches the differences between kind of ceremony setup, group work, individual work. Maybe we'll talk about some of that today. So I'm a psychedelic psychotherapist. That's really the primary focus of my work. I'm also a fellow at the Institute of Noetic Sciences, which studies consciousness and transformation from a lot of different lenses. Also studies altered states of consciousness, near-death experiences, psychic phenomenon from a scientific lens. And that actually will play into non-duality and how I'm working. So I think that's good. I would like to start with a meditation so that we can all just ground together. All of us are coming with stresses, cares, and concerns. So I start all of my classes in Vital with mindfulness or meditation, depending on the day. So if you don't mind, we'll just do a really quick grounding as a group. And I like to start off meditation without closing the eyes. Just this, right here. Can you feel your body? Can you bring your mind's attention right into the body? Without getting into a funky position or even beautifully oming our way into meditation, just simply being present. What is body position? What posture? And as a group, let's take a deep breath, slow, deep breath. And sigh. Notice the shift of slowing down. And on this next sigh, we're going to close our eyes. So take a nice, slow, deep breath. And sigh. Now bring your attention inward, inside the body. Notice all the sensations that arise. Continue to breathe slowly, steady, slow and steady. We're going to do one full breath with a hold. So take a deep, slow inhale. Hold the breath. Inhale again. To the capacity, hold your breath. And exhale slowly down the body. And feel your body's response. Time shifting, perception shifting. Just this breath, sensation. And finally, bring your mind's attention to the heartbeat. Find the heartbeat in your body, in the face or the chest, the throat. Take one last breath into the heart and exhale slowly from the heart. And without losing this embodied presence, gently open the eyes. And if you could just write a word or a phrase about how you're feeling this very moment into the chat window. Serene and peace. Vibrant, energized, open, spacious and open, happy, expansive. This is 5 minutes of intentional practice. Look at the words we're coming out with. Tired, yes, sometimes we just notice what we're feeling in the body. This is 5 minutes of practice. This dedicated practice allows us to have this experience in 5 minutes, which then we can carry forward. And as it tapers, there does seem to be a half-life. We do it again, and we do it again, and we do it again until our life is filled with this kind of repetition, a flow of paying attention and then living, paying attention, and then living becomes paying attention. And that's what we're actually doing in psychedelic psychotherapy. We're learning to pay attention to everything that's happening in our experience, sensations, thoughts, beliefs, emotions, memories, images. All of these things become really present when we're on medicine. And my job as a psychotherapist using psychedelic medicine is to help people actually attend to what is arising, create space for it, make meaning if it works for them to make meaning of it. But we use what's arising to go toward a healing goal, a goal for healing, and a growth goal. So the differences in regular psychedelic therapy, where someone's on medicine and their eyes are closed with the thing over and they're just internally experiencing, and then psychedelic psychotherapy is I'm engaged with them the whole time. They and I are speaking back and forth about their experience, and we're really thinking about their growth and healing goals. So that's essentially what I'm doing. And we always begin this way, even before the medicine hits, so that they can begin to attune to themselves. Because what happens in psychedelic states is can be chaos, can be huge. It can be the big as the universe and the cosmos itself, or as small as just an itch on your nose. And so we want to really start paying attention to ourselves, because that's where we live. So, welcome. We're going to be talking about my book and non-duality and psychedelic psychotherapy and the Vital program, which I love so much. You want to come in and,
Amazing.
yeah.
Thank you so much for that beautiful meditation, Mike. It's yeah, truly such a privilege to have your expertise and especially your understanding of Buddhism and meditation in the program, because for me it really is the foundation of what we're trying to do and what we're trying to convey, and without which really psychedelic education in itself would be completely futile. So I'm
Mhm.
gonna start by just letting you all know who are here, that this webinar is also organized because we want to let people know about what we're doing at Psychedelics Today, and especially about our 12-month psychedelic education and training program Vital, which we're starting our third cohort on the 23rd of January, and the applications are now open. So if you are touched by this conversation, if you're interested in learning more about Mike's work, our program is one great connecting point, and you can find out more information on our website. So what we're going to be doing today is I'm going to be asking you some questions, Mike, about your work, about your book, and also about your experiences in Vital, and also about how you see psychedelic education going forward, and what do you think are the most important components of it. So first, let's really start with the subject of this webinar. So truth medicine and unconditional love, a non-dual approach to psychedelic psychotherapy. What is truth medicine, and what inspired you to use this term, and
Mhm.
how can psychedelic education help us access that?
Yeah, so as a clinical psychologist, I was finding that almost everybody's diagnoses, almost like depression, anxiety, even trauma diagnoses, like PTSD, were were coming from a misalignment in people. I don't really tend to use diagnoses, and I only get clinical when there are really presenting issues that need to be addressed clinically. But most of my work is it's soul oriented, heart oriented. And so, what I mean by misalignment is so many of us are not living the lives that are truly authentic to us. And we end up generally living the lives that are either prescribed to us by others or our culture, or have been instilled in us, or ones we've internalized. So from our caregivers, if they have messages about us as children, we generally internalize those messages, not realizing that those are opinions of other people. It's hard to discern that as children, like, wait, my mom and my dad have opinions about me. Even if your mom is like, you're so talented and so smart, that would seem lovely, but then it's a pressure to be talented and smart. So you take on these opinions of others thinking, oh, this is who I am. And then you're 20, 30, 40, and you're like, why am I not feeling good about who I am? And then as I do my work with them, especially in using psychedelics, the truth starts to come out. I don't believe that about myself. I don't want to believe that about myself. I don't want to do this and I don't want to do that. That's not who I am. Depression for me is like this depressed sense of the soul or our originality that really wants to come out. Anxiety is worry and frustration and restlessness that I can't do what I really want to be doing. Of course, that's simplified. Those are more complex than that. But really, what I've found over a long time of doing this work is that when people are misaligned with who they are, their authentic, true nature, they're depressed, they're anxious, they feel traumatized, they feel like I'm not in the right body, I'm not in the right consciousness. And that creates so many problems for us physiologically, neurologically. Our health, our stress hormones are more activated because we're just not happy with who we are. And so while I was doing lots of ketamine psychotherapy for people, what would always come out is their truth. And it was so powerful to witness a person say, no, this isn't right for me. I don't want to be talked to that way or treated this way. I don't want to be this person. This is who I really want to be. And as I started encouraging them to say it and then to start embodying it, so many mental health issues decreased, a sense of well-being and thriving increased, a sense of personal connection, a sense of relationship to one's spirit or soul, uh, original essence became much more prevalent. And really, so truth medicine, the truth is medicine. The psychedelic gets you there. And then the most potent medicine is unconditional love. And this is love that is unconditioned. I know it sounds like, oh, yeah, unconditional love. But when you think about it, do you offer yourself unconditional love, or is it conditioned on how you perform, on how you achieve, on how many people love you, on all of these things? Or do you wrap yourself and say, I love this being, I love myself unconditionally, even with my flaws and my faults and my history and the things I've done to hurt others? Because when we truly do that, there's nothing we can do that doesn't deserve our love. And so truth leads us to authenticity, which I found reduces mental health concerns and increases well-being. And unconditional love actually touches the very source of the world itself. Because I have found in my non-dual practice that the source of life is unconditional love. And it's formless, but it arises as a field. You can tap into that field. It's tangible. You can feel it, even if it's formless. And we can become that. We can infuse our normal waking selves with unconditional love, which is the feeling of the source of all of life. And they're both here at the same time. Our suffering and unconditional love is here at the same time. And that's a non-dual approach. It's nothing you have to do. It's already here. And ironically, you got to practice and remember. So, so I'll just leave it at that for now and see if you have questions, if you have any thoughts on that, but that's what truth medicine is and what unconditional love means to me.
Amazing. I feel like during this conversation, we're really going to get to some places that are really very much at the heart of also what we're trying to do at Vital. And I think the sort of funny thing when I'm listening to you talk is that it's like, yes, this is the caveat. Psychedelic psychotherapy is about love, and it's a very sort of it's a hard thing to sell in a way, but it's like without it the healing cannot happen. And also what we do in Vital is that we're trying to create a community which is so supportive and so nourishing that the healing happens almost as a byproduct of you improving on yourself and learning about yourself and just connecting with others. And the psychedelics are part of this toolbox, but really they're not the center. They are just there to help us to discover the ways in which we can love each other and ourselves better. And so I love that you're making this to be such a central component for your work. And I think this was also something that you had planned as a title of your book. Is that right?
Yeah, the book title at this point is Truth Medicine. I don't have the subtitle yet. I was going to do it Truth as Medicine or Truth Serum, but then my colleagues were like, that's too CIA, so don't do Truth Serum. And I have friends in the special ops community who are like, oh yeah, we actually practice with these kinds of medicines to see what kind of truth we can get. So I was like, oh, let's just call it Truth Medicine. But really what I'm discovering is truth is the medicine for so many of our ailments. Our psychic ailments are coming because we do not speak our truth to ourselves primarily, and certainly to others. We please, we fawn, we're like, oh, I'll just acquiesce to your needs instead of really saying, no, that's not right for me. This is right for me. And learning to say this is right for me is so empowering. It fills us with a sense of like, well, the word power can be loaded. So empowering, this sense of fullness, of connection to ourselves in life. And truth, I have found, has done that for us. And of course, what I love about Vital and our program is we actually teach about breath work and other rituals that can get us to non-ordinary states of consciousness, like holotropic breath work, drumming, and dancing, tribal dance, can get us to the same non-altered altered states of consciousness. So the medicine is one way into the state of into a non-dual state, which we'll talk about in a moment, but into the state of unconditional love, the field of unconditional love. Yeah. So what was ironic is I teach this, and I was invited to a grand rounds at a hospital to teach on some of this. And there were primarily older white doctors in the audience. And I talked about love. Like, this is medicine. And I'm not joking. The room started doing, I'm like, damn, I'm going to have to work hard to get this crowd to really like feel what I'm talking about. Another aspect of non-duality is its direct experience. It's not psychological or intellectual experience of the source and of love. It's the direct experience. And so what I had to do with that audience is bring them to a direct experience of love. My point being, for that audience and for us to realize, is that a lot of our clients self-sabotage and do not love themselves. So there's a part of all of us that when we dislike ourselves, we push away good medicine. So I was telling those doctors, if your clients or patients are not taking the medicines you want them to, it's more than likely they're sabotaging their own well-being. So if you don't bring up love with them and self-love, then they're never going to change their minds about, I need to take care of this body and my brain and my health because I don't love myself. So in my work, so much of it is starting off with self-love. Starting with self-love. That is what we target. Because once we start with self-love, then we can move through our treatment. Because I've found if I don't start with that and we're just trying to help them feel better, like, oh, I'm less anxious or less depressed, I'm like, who cares if you're going to continue to sabotage because you don't love yourself? Great, you don't feel as depressed. That's awesome, but is that sustainable if you don't care for yourself deeply or love for yourself? And so what I do in the beginning is work on how can we have a loving relationship with ourselves. And a non-dual practice really touches upon that pretty quickly. So with my own teacher, Richard Miller, my non-dual teacher from the Kashmir Shaivism lineage, I love he starts off most of his retreats saying, I'm going to tell you the secret up front, and we're going to work toward it the whole time, instead of just at the very end going, here's the secret. It's like, let's start with the secret, and then we're going to infuse it into everything we do throughout this whole retreat. So I've taken my cue from him and do that in my work.
And what is the secret?
Love, unconditional love, and finding, speaking, and living our truth. Those are my medicines. Unconditional love for ourselves, for the child that was hurt, harmed, and then discovering, speaking, and embodying our truths, which can change. They can change over time. I know mine have. So it's a constant reflection. It's a constant work of what is my truth, even in this moment, what's my truth?
Yeah, it's like Ram Dass, who is surprisingly not sort of as often acknowledged as like a psychedelic elder as Timothy Leary, for instance, or Terence McKenna. That's all he said. Speak the truth, love everyone. That's it. It's relatively simple. And also when I'm listening to you speak, just this word simplicity really arose for me, because it's like a lot of this work is really about stripping away, not about adding on, but really in what ways can you become more simple and content and appreciative and grateful for everything that's around you. And really that's the work. And while in Vital we teach you skills of harm reduction and integration, we are really also focused on this part of inner work and like, how can you find peace in your day-to-day life? How do you find ways of working with yourself, your own intuition and your feelings, so that once you enter into this field and you hopefully work with other people and help other people, you're centered enough to do so. So I would love to also hear a little bit more now, since you wanted to talk a little bit about non-duality specifically. So
Can I actually say something? I'm so sorry to interrupt.
No,
I
no,
wanted
please.
to follow on what you were saying about what we're teaching.
Yes.
First of all, these teachings are extraordinarily simple, but it's very difficult to do. The tasks are not easy. The tasks that I give my students, clients, and patients are not easy, but the truth is simple. And so it is actually simple. What the Dharma is very simple in essence. The practicing of it, the embodying it is can be very difficult because some Anna said, thanks, Mike. How does a person who's disconnected from their feelings start to develop this unconditional love? This is a very arduous journey of going into our deepest pain. And
Mm,
so we as facilitators, and I'm training facilitators, and that's a complex process. How do you face the dragon of your pain? It is so scary to face the feelings you have disconnected from. And I'm asking my patients to go into the maw, the jaws of the dragon. Literally, it's a dharma gate. Your pain, your suffering, the untended grief, the anger and rage, these are dharma gates. These are not to be avoided. These are actually to be courageously walked through, just like Luke went through that forest and Yoda said, he said, what's in there? And Yoda said, only what you take with you. And that is fucking scary because what we have in us can be really scary. The depths of our psyche also contain some demons and shadows. Those are not bad, not at all. They have messages that we've been avoiding. So we actually have to learn how to take this journey through. And what we do in Vital is we help teach people how to lead others through this successfully with the most in the most safe and the most ethical way we possibly can. The truth is simple, but the actual techniques are quite complex and subtle, and there's a lot of ways we need to work with someone in an altered state. So Vital does, I mean, that's why I'm in this teaching it, because we're doing a very good job at teaching what's very complex.
mm.
So I just wanted to say all those things.
Yeah, and actually now that, well, I want to add to that that what I think is really foundational for psychedelic education, and I think this is also one of the sort of basic principles of Buddhism as well, and probably for many other main religions of the world, is this act of service. And what we teach comes from the tradition of Stanislav Grof's work, and we, for instance, at our retreats, we use the sitter purse that people typically use in holotropic breath work. And what I've seen time after time is that the experience for a person to be in the service of another person for some time
Mhm.
and to give them the love is also a healing experience in itself. And we just, it's kind of, it's backwards, but we live in a society where we don't really oftentimes get the opportunity to actually be there for other people. And hopefully this is also something that psychedelic education can teach to others, is like how much it gives to people and how much it enables them to actually begin the journey of loving themselves
Mhm.
when they can be there for other people's, when their exchanges become more authentic, when they're not no longer transactional, but when they're just actually there unconditionally loving another person like a parent would be loving
Mhm.
a child.
Mhm.
So yeah, um, amazing.
Mm. Should we
So
dive into non-duality?
yes. So how does the non-dual approach to psychedelic psychotherapy differ from other approaches? And do you think it should be a foundational approach?
Who knows? But I'll tell you, it's the one I use. Talking about non-duality is a beautiful, difficult thing because it's an experience, and to really have it is what I would love to do is spend an hour in meditation with all of us, just touching it. It's both and. It's everything is included. It means not to, literally, not to. It's both the source that is formless and all the form that arises, thoughts, sensations, all the conditions, nature, the elements that make up this world. And it also includes the formlessness of potential. So it's both form and formless at the same time. It's opposites together. It's anger and joy arising at the same time, not one or the other. It's that both exist simultaneously, as all things do exist simultaneously. there's and energy is still a part of the form, actually. Everything we experience. In some yogic tradition, it's called Prakriti and Purusha. That's one concept. I think my non-dual Zen teacher is here. Larry, if you want to write what you think what you know non-duality to be, you're more than welcome to put. We have the absolute and the relative. The relative is this Mike. Mike's got trauma. Mike's got issues. He used lots of drugs in his past. He's made some trouble in his life. He's a great guy. I love this guy so much. And there's also a pure essence that is beyond personality, beyond form, that I am as well. And in meditation, we might call it pure awareness. And everything that arises in your awareness is an experience. So we can be both pure awareness and the experience and the one who's experiencing it. Let me say that again. We have pure awareness. It's no form. It's not attached to any person, place, thing, or any consciousness. It's bigger. Then I have Mike, who's experiencing sensations, emotions. And then I have a witness who's watching Mike experiencing those things. So those are all these different levels. And so when I'm doing all of this in therapy, we're helping a person become spacious awareness that has no boundaries. We're helping them become the witness of their experience. And then we're helping them just be in the experience, all simultaneously. And here's where I use it therapeutically. That pure awareness is just radiant love. It is peace itself. When we tap into that peace or unconditional love itself, we then take it through the journey of working through our traumas. Instead of going to the end and waiting, like if you do all these things, that's a dual path. You do this, then you do this, then you do this, then you do this, and maybe we'll get to over here. In non-duality, that wholeness is already present. You have to experience it while you're working through your traumas. So you take love through the process of doing your trauma or healing work, rather than wait until like a lot of time later when you're like, I'm starting to feel better. If we can touch that pure essence within us or unconditional love, then we take it through the hard parts, that Dharma gate, that dragon's mouth. Then we take love with us while we're going through our trauma work. So for me, I'm starting with what's already here, whole, unbroken. And then we go right through all of the work we're doing with that radiant, pure love. That's how I'm bringing the non-dual approach. A dual approach is you do this, you get into heaven. A non-dual approach is heaven is right here, right now. It's about remembering and being it at the same time you're being this relative self. And then Larry, just this. That's what my meditations are, just this. So there's from a Zen I'm a Zen student under Larry too.
So yeah, this is amazing. Thank you so much for this, Larry.
Yeah.
And thank you, Mike. I have a follow-up question to that, which is also something that came up in the chat about since you've gone the journey of being a monk and then obviously become a regular secular, well, not secular person, but
just a dude. Yeah.
Yeah, just a regular dude. So obviously you have at some point in your life, and I assume still have a relatively rigorous meditation practice, which I assume for you is the foundation for accessing this non-dual awareness as well as the unconditional love. But how would you say that for another regular dude or dudette, this path could go, and what are the sort of important components for accessing that?
The unconditional love or the non-dual state?
But both. But I mean, if you want to speak on them separately, that would be good too.
Yeah. And also there are medicines that kind of facilitate this. Strange enough, ketamine is one of the medicines that seems to be the condition for non-dual experiences to arise. Because I know I'm not answering your question, but I want to relate this to psychedelics for a second. In ketamine, you do have a sense of dissolving and you become space itself. And then there are forms that come up in there, like your memories or your own experience in the present moment, but you're also watching it at the same time. So I've found out of all the medicines, strangely enough, ketamine is the one which has provoked more non-dual experiences than any other. Because you're using, let's say, DMT or 5-MeO DMT or psilocybin, you get tons of images and sensations, and the experience is robust and big and sometimes huge, and maybe there's spirits or entities. This all exists as in the form state, but in ketamine you actually get to dissolve, and your identity dissolves completely, and all of a sudden you are just it. Just this. You become it. And it freaks most people out. I remember one of my first true non-dual experiences of dissolving was in Thailand, and I was sweeping in the temple, and everything disappeared. Sweeping disappeared, I disappeared, the world disappeared, although it was still going on. And then I heard a small voice, as if it's in the back of a cave somewhere, going, "But who am I?" And it was just a voice from just like wind. And then it said, "But who am I? And who am I?" And then it started freaking out. And then I identified with that voice and identified with the freak out. I'm like, I don't know. Who am I? Like, where was I? What just happened? I don't even know. If that's true, then what is this? And I went up to the teacher I was living with, and I told him, I speak Thai, I told him what happened, and he laughed. He goes, "Ha ha ha ha, go back to sweeping." Which is the best. He was a Theravada teacher, but that's the best Zen answer you could ever have. Go back to sweeping. And so it's something so ordinary and something so fascinating and majestic at the same time. A non-dual experience of both this and that. I am this, I am that, I am all of it. I am not even here. It's just this. This can happen, and it frees us. It completely frees us from the very tight bonds we have on our disorders and diseases and our pain and our suffering, because we are stuck in a trauma body all the time thinking, "Oh, this life sucks. This is so hard. I'm always this and that." But when you get this non-dual experience, you experience freedom, complete freedom, and then you can come back and integrate that freedom within this trauma body. That's what we're learning to do. So the non-dual state and our waking regular state integrate.
And so what would you say, what are also the methods for finding a balance between being in this non-dual awareness where you are the space that you've just described, as well as being in one's ego and living the ordinary day-to-day and taking care of one's mundane business? Because I think this question is really important for when we're talking about psychedelic experiences and how we go into the psychedelic experience and how we integrate them. And for somebody coming from the more Jungian background, for instance, Carl Jung was somebody who had a great suspicion towards psychedelics, because maybe perhaps specifically because of this, because he thought that they were too boundary dissolving, and for a lot of people their psyches couldn't handle it.
Yeah, and for some people, they honestly shouldn't do psychedelic medicine. There are ethics involved with people who have loose boundaries to begin with, and I mean psychic boundaries. Those who might be perceived or being diagnosed as schizophrenic or bipolar with psychotic disorders. Not that they can't do it, but that we have to be very careful, because their boundaries have already kind of been dissolved. We need more integration for those folks. But most of us who don't have those conditions need some disintegration of our sense of self and the boundaries we hold. So that's that. But what was your question? I actually lost it in that.
It was just like, how do we navigate between also these sort of substances that trigger the non-dual awareness, and like, how do we find our way back to the integrated ego, so to say?
Yeah. So I'm trying to do that simultaneously with my clients. I don't want them, but they get to have this non-dual awareness. They get to dissolve, but even in the therapy, they're coming in and out. They're like back in their ego selves. They're going, "What just happened?" And then I might explain it and we talk about that. And then we start integrating that into, even on the medicine, how can you use this when you're feeling pain from your trauma? How can you see it in a different way from a different position? Can you hold space for it? Someone with chronic pain, let's say a torn bicep one year, they hurt their bicep and it always hurts, and or their back, low back pain. But in non-dual awareness, it's just a star in the infinite galaxy of the universe. And so when we're in that spaciousness, you might feel that pain, but there's also a million other things coexisting with that pain, which
Mm,
means you can direct your attention anywhere you want to go, which means you can be free from acute pain. It still arises, doesn't mean you prefer it, but it gives us spaciousness. So what I'm trying to do in psychedelic psychotherapy, when they have non-dual experiences, are to integrate that within their ego, so the ego can be both and too. The ego can go, ego can say, I don't like this pain, but I am also more than that.
mm,
So now we're starting to become more than, which is what we always are. Jack Kornfield has a great book, After the Ecstasy, The Laundry, which really talks about ways to integrate the profound mystical experience or the profound non-dual experience that we get in deep meditation or psychedelics in our daily waking life. The laundry is folding itself. I am the laundry folding itself. Like, where there's, you just have these moments in life to really reduce our suffering, because our suffering is we're clinging on to what we think we want to have happen, or we're trying to push things away we don't like.
mm. Beautiful. Thank you so much.
Yeah.
And I wanted to also ask you, since you work both in with individuals as well as with groups, how do you see these dynamics play out when people are in a group setting, when there's sort of so many different moving pieces versus when they are in an individual setting? And do you have a preference for one or the other, or like in terms of what substances might be more fitting for one or the other? And yeah, what might be more conducive for cultivating that non-dual awareness, or
Mm-hmm.
can both be applicable? Maybe you can just riff on that.
Yeah, I lead groups and we use psilocybin in our groups and ketamine, different groups for different populations. And I am hands off generally when people are in groups. That I'm not a psychotherapist, I'm a ceremonial space holder, but I do transformational work beforehand. We do so much prep work. I don't mean individually, we do that too, but in groups. I am doing yoga nidra meditations a lot, which is a non-dual meditation from the Kashmir Shaivism tradition, or really Indian tradition, yoga nidra practice. And I'm doing a lot of truth speaking before we even go in to the medicine. So my veterans and I have very, very real and raw talks the night before they even take medicine. And these are really stoic men and women, on purpose. They, it's a way to compartmentalize feelings, but I help them break down their barriers the first night. And then we do a lot of deep meditation to get them to touch even a little bit of love. Little bit. All you need is a little bit, because it's a pinhole, shows you the fabric of the universe. Just a pinprick is enough to let enough light in to go, holy shit, that's what I've been missing, or I need to feel that. So I help them speak their truth the first night, and we do meditation the second morning, the morning of the medicine. We do more meditation. We touch into ourselves and into the fabric of the universe. And then I let them be during their journey. I only intervene if they need help, if they're having challenges. Otherwise, they're in their own experience. And whether they have non-dual experiences or not, I don't know unless we talk about it afterward.
Mm,
Individually, I'm there with them, talking with them the whole time. And the medicine, the way I get them to a non-dual experience is by continuously asking them to let go.
mm,
Let go of that idea. Let go of your hold on yourself. I'm so scared. I'm scared I'm going to die. I say, die then. You're not physically going to die here, but die. Let yourself die. Let go, let go, let go, let go. And they do, generally. And then whole world shifts for them. The whole universe opens. Surrendering and letting go are the two most potent skill sets that we can employ while we're doing medicine to have a non-dual experience. The ego is mightily holding on to its own conditioned, fabricated self, but when you can see it and you let it go, the universe literally will present itself to us, and then
Mm,
it can dissolve into the spaciousness that holds the universe. Letting go and surrendering, that's what I teach when they're on the medicine, and then we'll do psychotherapy when they come back in to their formed self.
thank you.
Thank you.
Yeah, that is something that also has come up in our last week's lecture. I think Don came and said something along the lines that that is why the death of the ego is so terrifying, because we have no idea what kind of person emerges after
Mm-hmm.
that.
Correct. Yeah.
So it's a wholly new existence in a way. But
Yeah.
then also this quotation that has come up for me during this past month in a couple of occasions is that the greatest fear is not that we're powerless, it is that we're powerful beyond measure. And I really do think that psychedelics can nudge us into that direction of like, see, you really aren't like infinitely small, actually. Actually, there's a
Yeah.
lot you can do in this lifetime. So better get to it,
Yeah. Yeah. This
whether
is
it's
your life to
sleeping
live.
or whatever it is.
Yeah.
Um, so
Yeah.
thank you so much for bringing that perspective in. And there is something that I really wanted to bring into this conversation also that has come up for me during this past couple of months, which is that how can we perceive better from the heart and not from the head? And you mentioned this in one of your recent webinars, and I was just curious to hear a little bit more on this. I'm definitely no expert, and I'm quite new to this understanding. But yeah, so wisdom of the heart. Can we actually use heart as a perceiving organ instead of the mind? And how may this aid us in this quest to non-dual awareness and unconditional love?
Yeah. And I don't know what you're referring to because I don't ever remember what I've said. So I'll believe I said it. But what I teach is bring your consciousness into the seat of the heart. Imagine instead of your consciousness being located in the mind, which you could say, I don't know what, what does that mean really, but in the intellectual or the perceiving mind, the conditioned mind, what would happen if you bring your own consciousness, conscious awareness here in your life, and you speak to another person from here, you problem solve from here. We have a term called bodhicitta. We can write that in here for everyone. The awakened heart. Ajahn Chah, who was Jack Kornfield's teacher in Northeast Thailand and Isan region, on the back of one of the books, one of, I think, the most profound teaching is the simplest. You get to a point in your practice where the heart tells itself what to do.
Wow, that's beautiful.
Yeah. So that has guided me for a very long time. And so my particular practice personally is to drop into the awakened heart. And that's intuition, wisdom, insight. These are what I cultivate most often: wisdom, insight. And that also is compassion. Compassion lives here. So I'm here. The seat of my consciousness is in my awakened heart. And I act, speak, make mistakes from, clean up those mistakes from, because it's not perfect. I'm a human being, but there's space for that. Intuition, wisdom, insight, compassion is this is where my seat is. So I encourage facilitators to be here when they're working with someone, but you come up here when you're problem solving. I need some judgment, discernment. I need even some creativity, although I believe that is here too. But the prefrontal really is great for problem solving and judgments, making discernment. So when I'm with a patient who's struggling, I have to go, what skill would I use here? But I'm still seated here in my heart. I'm just asking my mind for help. But most of us sit up here in the ping pong. Do I do this? Do I do that? What should I do? I don't know, this or that. And we're confused. We're spinning. It's hard to access the heart, love, kindness. So I'm suggesting we practice being here and then using our mind when we need it for its skill set, rather than being intellectual, disembodied, spinning in yes or no, this and that all the time. I don't know what's real, but your heart does know what's real. So
Mm.
come here. Learn to live here as a practitioner and as a facilitator, as a client, as a human being. Learn to live in the radiant, awakened heart and do all the work from there.
In one of your lectures, you also said that you spoke about this concept of inherent goodness. And I thought it was just a really beautiful thing to bring in, because as we are talking about psychedelic education and just even about who can provide psychedelic education, who is qualified enough, who can teach in this area, it's I think it's very important to recognize that we are all new to this and that we are all learning, and therefore we will all make mistakes here and there.
Mhm.
And good intentions doesn't cover for everything, but I think if you wouldn't mind talking a little bit on to this like notion of inherent goodness and what it means to just really orient oneself from that perspective.
Are we talking about as a client would or as a practitioner facilitator would?
Well, I was thinking more from the perspective of a facilitator, but I think if you want to do both, that would be great.
Yeah.
Thank you.
Well, the facilitator of a psychedelic experience needs actually lots of skills. This is what we teach in Vital and what we're developing hopefully in our second program, like in more in depth, actually on the ground skills. A person leading a psychedelic experience, even if they're not doing psychedelic psychotherapy or just sitting with someone on a medicine, has to have a lot of skill set to navigate the interpersonal energy and reciprocation of relationship that's going on. They have to navigate somebody's medical and physiological states in case they get sick or something happens. They have to navigate that person's terror or joy or sexuality, and they have to help that person navigate the cosmos and their psyche. Even if they're quietly sitting, that person's having a huge experience. And so the facilitator needs to have a lot of skills to be able to do that, because it's quite complex. I mean, yeah, you could just take drugs and everyone have a good time. That's okay too. But when we're talking about it in this way, in this healing and growth and transformation, it takes a lot more skill set. But the innate goodness of the person sitting here is what naturally radiates and becomes presence to the person who's receiving the support. So the practitioner, we're human beings. We need to work through our stuff. If we can find our innate goodness and radiate that out, which is presence, then we can help every client, participant, or student also access their innate goodness just by feeling ours.
Mm.
And on the other side, for the client, what I'm talking about is innate goodness. We're born with it. It's the opposite of original sin, which is the most effed up concept in humanity, that you are born not pure, that you're born or inherently evil or dirty. I mean, what an awful construct to put on ourselves. I was sitting with and this is going to be in my book, I was sitting with my ex-wife and she's pregnant. We were having lunch and I asked her about the consciousness of her baby. Like, could you feel it? Do you have an experience of your baby's consciousness? And she sat back and thought, and she said, I don't know. I said, well, what does it feel like? What does the presence of your baby feel like? She put her hand on her belly, closed her eyes, and in her very gentle, sweet, kind way, she looked at me. She goes, pure and soft.
Mm.
And I touches me. And that is all of us, all the time. That's what I'm going toward. That's what I'm helping people go toward.
Mm.
That each one of us has a radiant, pure, and soft essence that has never been lost. That's my
Mm.
work.
Thank you for sharing that.
Mhm. Do we have time for questions or anything? I think a couple minutes. Do y'all feel that? I was like, damn.
I feel it. Well, if you have any questions, you can put them in the chat while we have just a few minutes left of this hour. And yeah, it's been an incredible hour that flew by.
Yeah, it
Thank you
did.
so much for your energy and your work and for everything that you bring to this community and to Vital. And we're so grateful for you,
Mm-hmm.
really.
Thank you so much.
Is there anything that you would like to say about your book or about your
Oh.
work before we close here?
Mm-mm.
Um,
My agent wants you all to follow me. I don't really care, honestly, but my agent does. So Instagram is the way to do it. But the book will come out probably in 2025. We're working on. It will be called Truth Medicine, something, something, something. Um, I'm just focused a lot on my first responders right now, and then in teaching in Vital and creating new programming for Vital. My job is to scale me. There's only one Dr. Mike, and I'm really helping all you guys. And there's some students right here with me, and I love my students, and they're going to be trained in this. The students that are right here are getting this heart-centered approach for psychedelic therapy. I think what I ended on was that I'd like all of us to spend some time with the radiant, pure, soft essence of ourselves. That's what I'm asking and leaving this conversation with.
mm, I can really feel that.
Hmm.
I'm putting it just there. Yeah, my just
Okay.
Dr. Mike voice. I'm really feeling it. Thank you so much. This has been so wonderful. And for me, this is the very hard to translate foundation of psychedelic education. And this is the where we all should be aiming towards. And everything else is kind of just noise. So I am so happy that we actually managed to get to that point during this conversation. So thank you for that. And I think your background is something that would equip anyone for it, but it just goes to show like how our spirituality and how our worldview and how our day-to-day orientation and the way in which we conduct ourselves towards others is like, this is the work. This is how you become a practitioner if you want to become one.
Hmm.
And you can take as many training courses as you like, but if you don't have this, it's going to be really hard to
Hmm.
do.
Yeah. Thank you all so much. And thank you. I'm so glad you and I did this together. I knew it was going to be just perfect, the two of us engaging this way. Thank you.
Amazing.
Heard
Well,
that. Yeah.
thank you so much, everyone. I am going to drop the link to Vital here in the chat. If you have any questions about the program, so students can follow you on Instagram. And when can we actually expect the book? It's about a year now from
I
now, right?
think yeah, we're actually switching publishers, which is a very funny story for another time. Here's my website. But the book should be about a year or so. It's almost done, but it has lots of things to do. So
Mhm,
you all, Vital will push it. You can all get it once it comes out. So
mhm.
thank you.
Okay. Well, this has been just incredible. Thank you, everybody who stayed, and we look forward to hearing from you. And thank you, Mike, and I hope you have an incredible day. And I'll talk to you soon.
Bye, everyone. Thank you.